Okay, you guys, I'm making a video about what I'm packing for the DR, and I want to explain everything to you because I know some people don't understand, what's finna partake, as in, me getting a BBL, tummy tuck, and liposuction. Okay, so I've been watching a lot of dolls videos, and I got a lot of good information on what to pack. Now, I'm not taking everything you see here, but majority of it I am. So let's get to it. So, okay, so when you get a tummy tuck and a BBL, you're gonna be, have to have liposuction, and you're gonna have to wear a garment afterwards and stuff like that. So I got my foam boards for my faja. This is the one that go in the front, and this is the one that go in the back. I haven't got the foam for it yet. I'm waiting on them to deliver that, which will be Monday. I got my compression socks. I had a pack of those. I think it's 12 in here, 6 or 12 in here. However, I made sure I had plenty of compression socks. This is my waist trainer. This is going go on after the stage 2 faja. But I'm gonna put this on 2 weeks after the surgery. I got my boppy pillow. You gotta have a boppy pillow. I will be ordering my BBL pillow next month sometime, probably in January. Probably January. Well, no, I order in December. Okay, my surgery's not until March the 5th. Okay, let's get to it. Of course, we're gonna be in the DR. I don't know, how the TV services is or how it's gonna be, but I bought 2 books that I'm dying to read first. I want to read both of those, but I'm gonna say that for the DR. I bought this just in case I be running a fever, but I'm gonna get the other one because this is the one you rub on your forehead. But I need the one, probably stick in your mouth. But Dollar General was closing, and I got this at a real cheap price, like 50 cents, something like that. Of course, you're gonna need this, because you're gonna have roommates, and when you go do number 2, you don't want it to smell and blow up the room. So I decided to get this, so just in case, when I do go to number 2, they won't know I'm doing number 2. Not as I'm not ashamed, but I don't want to smell my own ass, let alone somebody else's. You did? Okay, we needed some antibacterial soap, hand soap was recommended. Um, Dermablast for pain, burn, itch, and after you get liposuction and when you start to heal, you get itching real bad. This bad boy right here is for itching as well, but I am getting my inner thighs done, and another dog told me about this incredible man-made machine that's gonna help me with my itching on the inner thighs. Thank me later. And I thank her for telling me. Alcohol pads, gotta have alcohol pads because you're gonna want to make sure that your room stay clean and sterile. Anytime you clean an area, I always use alcohol pad. Of course, you're gonna need chapstick because sometimes when you have surgery, you bound to the bed. Sometimes, not all the time, but you don't want your lips to be chapped. This is for my luggage. That's something that we're gonna need for security purposes at the airport. Laxative, sometimes when you have anesthesia, it kind of backs you up and not, letting you go to the bathroom, so you're gonna need that laxative to help. Dial soap, they prefer you to bathe with dial soap, antibacterial soap, that's what you need. Peroxide, again, to help clean with the wounds and stuff. You're gonna need that. Okay, I don't need this, but like I said, again, Dollar General was closing, and I got this at a real cheap price. All right, but you're gonna need the B12. You need to start taking your vitamins and stuff before, like 3-4 months before you have your surgery. Some more anesthetic gel, just for your itching and your burning sensation. They say you need to, get up on your vitamin C's. Your vitamins is essential to your surgery because you need make sure your hemoglobin is on point. Leave, of course. Sometimes they said that Their medicine is not strong enough, so you might need some extra. So I got backup. Okay, and I have this. I forgot what I got this for. Oh, anesthetic skin cleanser. So you're gonna need that. You might need to do this before surgery. Sleep aid, I probably ain't gonna need it, but just in case, I'm gonna be on point with that. More antibiotic cream, for the wounds and stuff, making sure that I want to be safe. You know what I'm saying? It's nothing like having surgery and then you wind up getting an infection. That's not gonna be me. Benadryl, of course, for the inner itch that you can't scratch. We get the Benadryl and stuff. The arnica gel that's gonna help with the swelling, and it's gonna help with the burns and stuff like that. That's for that. Cough drops. A lot of time when you have surgery and you have a tube down your throat, since sometimes sometimes it makes your throat hurt and stuff like that. But if you ever had surgery before, like I had a tummy tuck, and you know what I'm saying, you don't want to get sick, but at the same time you don't want to cough either because it hurts. Sorry. Okay, moving along. Of course, that's for my bands, my drains, not drains, but my stitches. When you get cut and you have tummy tuck, you're gonna need all of this to change. But I just gotta give me some gauze. This is the help, with the freshness, cleaning, your woo-ha, because you have a faja on and you want to be fresh, and, you might not, you can't take a shower for like a week or two, so, they'll bathe you, but, so you want to make sure everything is fresh at all times. You have your gloves, must have your gloves, you don't want to be changing your dressing and you don't have no gloves, you want to make sure that everything is sterile. This is your flushable wipes, just in case you number one and number two. You like I said, we're in a third world country, but I'd rather be safe than sorry. But I need those. This is a female urinal where saying when you have the faja on, it's hard to put on and off, especially if it's tight. You always gotta have somebody to help you, and that's just gonna be aggravating just to sit up here and pull that thing on and off. So this will help. I'm gonna give the other one for the DR. This might be for something, when I go out in public and stuff like that. I get a little bag to put that in. It sounds disgusting, but it will help you along the way. I know everybody wondering why I have the pool rings, the swim rings. Okay, so after you have a BBL, you cannot sit directly on your butt. I know we have the boppy pillow to help, but when you're sleeping, you want to be comfortable, and what I'm saying, I feel like if I have this pool ring, it will also help me to be comfortable, because you're gonna have a lot of pillows, and you got to figure out. I have to figure out a way to sleep best way I can, but I seen a couple of videos, and I think this will be very helpful for me during this transition on getting my BBL and stuff like that. Moving along, this is a safe that I had purchased off of Amazon. It's for when I go to the DR, because when we go to the DR, we have to take cash. So I'm gonna have a lot of cash on me. So I want it to be safe and protected, just in case, like when I go to surgery, I want to make sure that my money is secure. I'm gonna have somebody with me, but at the same time, I want us to be protected. Moving along. Passport. Finally got my passport. We got to make sure we have our passport before we go out of the country and stuff like that. And some female necessity, just in case. I plan on going to the doctor, getting a depot shot, because it stops your menstrual, and I think that would be the best thing for me. Ain't got time to be dealing with no menstrual while I'm recovering from a BBL and a tummy tuck, and then you gotta be in the faja. I don't like pads and stuff and all this stuff, so I'm just gonna get the depot shot so it will stop my menstrual, so I won't have that problem. But I got these just in case. Moving along. So I got some tank tops. Well, they are tank tops, but they like shirts that we have to wear under the faja. And I know a lot of people are like, don't get the spaghetti strap thing because it will embedded in your skin. So I got something a little thicker. I have regular t-shirt as well, but I have plenty of shirts. I want to make sure, I wear a different shirt under my faja. Every time I come out my faja, change, because they wash a faja every day. I want to have something to, I can put on a different shirt to put under it. I want to make sure that, I have choices and be comfortable. I want to be comfortable. This is the regular shirt. And I got about like 10 of these shirts, so I'm good. All these different shirts.
What you doing, Mom?
Okay. So, once you have surgery, you don't want to be wear a lot of clothes, because when you have the faja home from the dolls, you're gonna be uncomfortable. So I got this. Let's see if I can get it right here. I have this for to wear around, or maybe even I can go to the airport with coming back to when I make it back to Atlanta. I got this for the purpose, because you can't come out there for hot, and it's best for you to wear something comfortable. And I have 2 of those. Maybe you can wear it to the doctor's appointment while you down there in the DR. But got it from City Trends for like $5.99. Something comfortable. A lot of dogs say wear something comfortable, because you really ain't gonna want to wear nothing but just the faja. But I have these, and I will be ordering. I'm undecided if I should get what you call it, a recliner, or get the lawn chair and cut out the middle. I seen that on one of the dolls on Dr. Jimerson page, Dr. Curve. Was a good idea when you come back home, because you can't have no pressure on your behind. You don't want to lose your shape and stuff like that. And we done paid so much money for this surgery, you don't want to mess it up. So I'm gonna do everything I can so I can keep my perfect round behind, and keep it up. Okay, so again, they say you probably don't want to wear no tennis shoes and get some house shoes. I like flip-flops. House shoes be too hot for me, so this is what I love. I will take a pair of tennis when I go. But yep, this is it. I hope this helps someone. Like I said again, I'm not taking everything that you see on the bed. I'm taking a majority of it, but not everything. A lot of these items will be extra careful when I return back to the States. But for the most part, all of this right here will be going with me. Especially this. Gotta have that, and my books. Gotta give me some good books to read. I don't know how the internet service is gonna be while we down there, so I'd rather be safe than sorry. Alright, you guys. This is it. Thanks for watching. And I hope it helps somebody just like it helped me.